Welcome to Masonicare and our Acute Care Unit, a dedicated hospital licensed wing at Masonicare Health Center in Wallingford. This video will introduce you to our hospital unit and let you hear directly from our clinicians as well as a recent patient, a family member, and a referring facility.
The acute care unit is an acute hospital, just as any other acute hospital within the state. We take patients primarily the age of 55 and above.
There's a sense of comfort right from when our patients and families get off the elevator.
Everybody was very friendly. Even if you didn't have questions, they would pop in and ask you if everything was all right. I was very pleased with the treatment I've had here.
One of the unique properties of our acute unit is having a physician on duty 24 hours a day.
24-hour medical care is a big draw because obviously if a patient has a medical problem, they want to be able to see their physician, they want to know that they're getting immediate medical attention and their problem is addressed.
Our residents and families have comfortable stay when they're here, and they know that they'll be returning to us, which is home to them.
It's really important to know that we're open to the public. Anyone in the community is welcome to come to the healthcare center.
I couldn't believe that ACU had such a different admissions policy than other hospitals that my wife has been in the past. She came in by ambulance and she was immediately brought up to her room, put into the bed before any paperwork or questions or anything was done. I couldn't believe it.
They don't spend hours sitting in an emergency room. It's less traumatic and less fearful for them to go through that process. And that's definitely one of the advantages of having our residents come here for treatment when they need it.
The average length of stay for a patient on our acute unit is 4.1 days.
We have a very liberal visitation policy, as we do recognize that families do work longer hours and might not be able to visit their loved ones until later on in the evening.
Pet visits are great for patients here in the ACU. We love to have any well-trained house pets come.
Part of the nursing process is creating a plan of care for every patient. I like to think of it as your blueprint for care.
Each patient does have a specific care plan, and it's a team approach, and I think that's really the approach in geriatrics.
We have great nursing staff, we have great nursing supervisors, our CNA and supportive staff are excellent.
It was being like welcomed into a family when you came. It really was.
I feel at the ACU the amenities were really great. I mean, I couldn't believe how comfortable the rooms were, how bright, and even the food. I mean, it was amazing. It was like a home-cooked meal, the main meal every day here.
They treated every patient as though they were the only patient here, as if you were the most important person that they had to take care of.
We hope this preview of Masonicare's Acute Care Hospital Unit has been helpful should you, a patient, or a loved one need hospitalization. Feel free to come for a tour or call us for more information. And remember, we're open to the community.